Having a police officer respond on their own can be very threatening and scary for folks who are in a mental health crisis. So having someone like myself who is not in a police uniform, but also a licensed counselor who has a little bit of a better understanding on how to help individuals who are in mental health crises is super important. It also takes a little bit of strain off of hospitals if we can divert people from a hospital and maybe get them like outpatient mental health support. It also eliminates people going to jail and overpopulating the jails. So overall, it just helps the community as well as all of the resources within the community.
The Regional Crisis Response Agency is a newly formed collaborative effort among the North King County cities of Bothell, Kenmore, Kirkland, Lake Forest Park, and Shoreline. This new agency deploys mental health professionals to serve community members in the 5-city region who are experiencing behavioral health crises. So I would say there's 3 primary roles that we have. We have the crisis response role. So it's a 911 call. It is somebody who is actively feeling suicidal. Maybe they have the means to harm themselves, so it's quite urgent. Another role is an assessment diagnostic type role, but I would call them quick assessments. A quick assessment to decide what do they need? What's their presenting behavioral health issue? And that helps us get back to police officers and say, we think the best thing is for them to go to the hospital now. We think that the best course of action for them is outpatient treatment, and we can help get them in to see somebody in the next day versus, if they're calling on their own. If a community member is calling on their own for treatment, it can take months. Some of the waiting lists to get in with counselors and therapists right now is 3 months, 6 months, whereas we can literally get an appointment in King County within 1 business day. Another role is our kind of our longer care, kind of that following someone's treatment situation or resource situation until they get what they need. So we're not treatment providers, but we walk alongside them, providing the care and resources until they get hooked up with the right person, the right place, the right treatment provider.
They are just able to help work with people and provide much more long-term solutions than what we are generally able to offer at the patrol level. They are also a great resource for officers. We go through a lot of trauma ourselves, and it can wear people down over time very easily. And so having them available to talk to for counsel and for that peer support has been phenomenal.
Having us as an education tool, as folks that can educate the community, the officers, the city, really, is huge. I've actually done, and my teammates have done, de-escalation trainings now to teach communication and de-escalation to public works, to parks. We did the online all-city training. The chief herself has said, you folks have changed the culture of this department. You have changed the attitude of how to help, when to help. You not only do help with the parts of the job that are difficult or beyond the scope of an officer, but you also have encouraged officers to want to join you, to want to help others in the same way. It's been really cool.